watching CBS 2 News This Morning in high definition.
Just a few days now, children will be getting back to school and back to sports as well.
But for those who haven't been very active this summer, just a few fitness tips can help keep injuries at bay. CBS 2's Dr. Max Gomez explains.
Sports are a big part of back-to-school activities for many kids. But unless they're physically prepared, injuries can and do happen.
Feel that?
Yeah.
Okay.
Youngsters who've been lounging most of the summer shouldn't jump right into the game come fall. Dr. Robert Gotlin, who specializes in orthopedic and sports rehabilitation, says a simple exercise program can help kids get back into action with increased strength and flexibility.
So the warm-up and the stretch is equally important just to prepare a child to get ready to play as it is to loosen muscles and ligaments.
Well, I roll it up and down in circles, like small, then we go to big.
Jordan Hausman plays baseball, basketball, and soccer, but being on the diamond is his favorite.
He's pitched a lot at a young age, and sometimes his arm has hurt, and so we've shut him down.
We err on the side of safety. If any child remains with a limp, or more important, has pain in one spot where they got hurt, that means they're still injured. They shouldn't play until that pain goes away.
Dr. Gotlin says, fortunately, most child injuries aren't major.
Pulled muscles or contusions or scrapes and bruises, and these will get better.
Making fitness a daily part of life can better the odds of avoiding serious setbacks like arthritis and other joint injuries.
We have injuries that occur that can be long-lasting and affect a child forever.
As a parent and coach, Mark Hausman's advice is easy to follow.
To work them slowly, to let them have fun, to let them be kids.
CBS 2's Dr. Max Gomez reporting. About 1.5 million high school sports injuries occur every year at about the same rate for boys and girls. Football has the highest injury rate, followed by wrestling, and then girls and boys soccer. Mary?
And Cindy, this week, 2 young football players in Bergen County tragically suffered fatal injuries during practice. 17-year-old Douglas Morales suffered a head injury when he was tackled. 13-year-old Sean Fisher collapsed from an undetected heart condition. So tragic when you hear about these cases. Dr. Merle Meyerson is a cardiologist at St. Luke's Roosevelt Hospital. We appreciate you being here this morning. It really raises an alert in parents when they hear about cases like this, especially these sports programs are just about to begin. So there are many concerns they have about their own children. And you have a program at St. Luke's to look into this, to find out if children possibly were born with heart conditions that maybe were never detected.
That's correct. We do have a program, pre-sports participation screening. So it's really to help not only the children, but their parents as well, to know the warning signs, the things that would raise a red flag to tell us that we should do more of a workup.
Let's get right to those warning signs. These are the signs that parents really need to look out for. First, family history of sudden death, of course, and fainting, you say, as well. Some people might just think that's dehydration, or maybe they're being overworked.
Fainting can cause from many reasons, but we think of it as telling us that we should look a little bit further. So anytime a parent knows that their child has fainted, whether they think it's because of the heat or not is important. It's also important if the child has a history of an irregular heartbeat, palpitations, a murmur, high blood pressure, or any chest pressure.
And those are some things that might not go detected all along.
That's correct, and that's why it's important to talk with your children and also have your children talk with their pediatrician to see if any of these things were happening but undetected.
So if they go to practice or they go to a game and they start complaining about little things, maybe they're not feeling up to it or maybe they're feeling dizzy, what should you do then?
First of all, let the coach know and let your pediatrician know. Oftentimes the high schools and the middle schools do have nurses, so any healthcare provider, it's important to bring it to their attention right away.
There are some preventative steps, you say, that every parent can take to make sure there's a complete history as to what's going on medically with your child. First is to give your child's doctor a complete family history. That's important.
Exactly, because perhaps nothing has happened to the child already, but if one of their siblings or a parent has died suddenly at an early age or has fainted, then we know we have to look for that child as well.
And you say very important to get that complete physical examination before they start sports.
Right, there's a physical examination that would be appropriate to screening for sports injuries and potential death. There's also other tests such as an electrocardiogram, which can be very helpful.
Now, when we talk about the EKG, we never think, at least I never think about it with children, but you're saying that might be a good idea? It's
been debated whether it can be helpful or not, because an electrocardiogram costs money. It costs about $50. So there is debate, and certainly in any time a tragic event happens, the debate again is renewed. Shall we do this on everybody or just when it's indicated? So we don't quite have the answer yet.
But for parents, what would be the key sign that I better take my child to the doctor?
Any of the things we just discussed, including the fainting, chest pressure, chest pain, high blood pressure, irregular heartbeat, those would be the signs where you want to speak to your pediatrician and perhaps consider further testing.
Dr. Meyerson, we appreciate you being here. Thank you so much for joining us this morning.
You.
For more on how to help your athlete's son or daughter stay safe, head to our website, WCBS-TV.com. Click on links and numbers. Cindy.
Mary, thank you.